A new healthcare study is raising serious questions about how some Medicare Advantage plans are sold to seniors. Researchers found that payments to Medicare Advantage insurance brokers may have reached more than $10 billion a year. For millions of older Americans, this story is not just about insurance companies or commissions. It is about trust, healthcare choices, doctor access, prescription drug coverage, and whether seniors are always being guided toward the plan that best fits their needs. Hello and welcome back. Today we are covering an important Medicare and retirement story that could affect seniors, retirees, caregivers, and families preparing for Medicare enrollment. A new research letter published in JAMA Internal Medicine found that estimated payments to Medicare Advantage brokers more than doubled between 2014 and 2022, rising from about 3.9 billion to around 10.1 billion annually. The study was conducted by researchers at Brown University and published online on May 18, 2026. Medicare Advantage plans are private insurance alternatives to traditional Medicare. Many seniors choose these plans because they may include extra benefits, such as dental, vision, hearing, prescription drug coverage, or lower monthly premiums. But choosing a Medicare plan can be complicated. There are provider networks, drug formularies, prior authorization rules, copays, specialist access, hospital coverage, and out of pocket limits. Because of that complexity, many older Americans turn to insurance brokers for help. The concern raised by this new study is simple but important. Are seniors always getting advice based on their best medical and financial interests? Or could broker commissions influence the plans they are shown? According to the JAMA Internal Medicine research letter, Medicare Advantage plans directly pay brokers an initial commission when they enroll a new beneficiary. Brokers may also receive renewal fees when beneficiaries stay in a plan. The article notes that brokers can help seniors navigate complicated choices, but they are not fiduciaries for beneficiaries, meaning they are not legally required to act only in the beneficiary's best interest. Brown University's summary of the study says payments to Medicare Advantage brokers rose from about $3.9 billion in 2014 to roughly $10 billion annually by 2022. It also says broker use increased during that period, with the share of first-time Medicare Advantage enrollees using brokers rising from 36% in 2014 to 44% in 2022. One major finding is that renewal payments appear to be a major part of the broker payment system. Brown University reported that by 2022, about 70% of Medicare Advantage beneficiaries generated a renewal, and renewal payments accounted for about 74% of all broker commissions. That means a large portion of broker-related payments may not come from helping a senior make a new plan choice every year. Instead, much of the money may come from beneficiaries simply remaining enrolled in the same plan. Medicare Advantage has grown rapidly in recent years. These plans are offered by private insurance companies that contract with Medicare. They often advertise extra benefits and lower premiums, but the details can vary widely by county, insurer, provider network, and prescription drug coverage. CMS, the federal agency that oversees Medicare, explains that companies sometimes use agents or brokers to sell Medicare health and drug plans. CMS also says brokers generally receive a first-year payment and then smaller payments in later years if the member remains enrolled in the plan. CMS also states that agents and brokers must be licensed, complete annual training, pass Medicare-related testing, and follow Medicare marketing rules. So the issue is not that using a broker is automatically bad. Many brokers may help seniors understand difficult plan choices. The issue is whether the payment structure creates a conflict between what is best for the broker and what is best for the beneficiary. This matters because Medicare plan selection can have real-life consequences. A senior may choose a plan because it has a low premium, but later discover that their doctor is out of network. Another person may choose a plan because it includes dental or vision benefits, but later find restrictions, caps, or prior authorization requirements. Someone with chronic health conditions may need regular specialists, specific medications, or access to a preferred hospital system. If the wrong plan is selected, The cost may not be obvious immediately. The impact may appear later through denied services, higher copays, medication problems, or limited provider access. That is why this story matters for ordinary seniors. It is not just about a $10 billion commission market. It is about whether Medicare beneficiaries are receiving clear, balanced, and complete information before making one of the most important healthcare decisions of retirement. For seniors living on Social Security, pensions, or limited retirement savings, healthcare mistakes can be expensive. A plan that looks affordable on paper may become costly if it does not cover a needed drug or if a preferred doctor is outside the network. Caregivers may also be affected because they often help parents or spouses compare plans, call insurers, review coverage documents, and manage medical appointments. For people in rural areas, the issue may be even more serious because fewer providers and limited hospital options can make network access extremely important. For low income seniors, dual eligible beneficiaries, and people with serious medical needs, plan choice can affect care coordination, transportation, prescription access, and out of pocket spending. The most important point is that this study does not prove that every broker is giving bad advice. It also does not prove that every Medicare Advantage plan is unsuitable. Many seniors are satisfied with their plans, and many brokers may work responsibly. However, the study raises a legitimate policy concern. When billions of dollars flow through broker commissions, the public needs to know whether the system protects seniors well enough. The researchers also caution that the $10 billion figure is an estimate. Brown University notes that the total could be an overestimate if some plans paid less than the federal maximum commission, but it could also be an undercount because the data may not capture large bonus payments tied to enrollment targets. For seniors and families, the practical lesson is clear. Do not choose a Medicare Advantage plan based only on a sales call, advertisement, or one person's recommendation. Before enrolling, compare doctor networks, hospital access, prescription drug coverage, prior authorization rules, maximum out of pocket costs, dental, vision, and hearing limits, travel coverage, specialist access, plan star ratings, and whether the plan still fits your health needs for the coming year. Seniors should also use official sources such as Medicare.gov, plan documents, and independent counseling services where available. This new report puts a spotlight on a growing part of the Medicare Advantage system. Broker commissions may now represent a multi-billion-dollar market, and that raises important questions about transparency, incentives, and consumer protection. For seniors, the message is not to panic. The message is to be careful. Medicare choices can affect your doctors, your medicines, your costs, and your peace of mind. Before choosing or staying in a plan, take time to compare the details and make sure the coverage truly fits your health and financial situation. Do you think Medicare Advantage brokers should be required to clearly disclose how much they are paid by insurance companies before helping seniors choose a plan? If you found this Medicare update useful, please like the video, subscribe to the channel, and share your thoughts in the comments. Your experience may help other seniors and families make more informed decisions.